central diabetic to live a relatively normal lifespan.
So what is your most successful treatment in Tibetan medicine? Digestion issues.
I cured a patient about 10 years ago in Japan who had terminal cancer. The doctor sent her home, they said you have treatment. I can't remember now so much, it was like stomach, lungs, bones, exactly. After 1 year, completely cured. She was quite an old lady and her doctors came up on her and said you have 3 months to live maximum. Just go home and enjoy your final days, and I kept her around for more than 4 years. You know, after 1 year, completely cured.
What medicine did you use?
Things like Sampel Norbu with Kyuna Genden. Samgen. This is a special Kyuna.
Yes.
Genden.
I've got it.
Yes. But with Chuma. So the Kyuna Genden with Sampel Norbu and Sengden Yenga.
Sengding or Zenden? Sengding.
Sengden.
Sengding Yenga.
Acacia. Yeah.
Acacia.
Acacia 25. Sometimes Dashel Ditsima is good.
Which one?
Dashel Ditsima. Dawi Rosero is another name. Dawi Rosero, Dashel Ditsima,
Medicine for the moonlight. Based on calcite.
Yeah.
So with a case like that, will you attempt to treat the cancer per se or just the organs?
Just what? Or both. Absolutely both. But I mean, we tend to prescribe strong medicines to try and dissolve the tumours.
Right.
We stop them from forming or growing.
Right.
But the attempt is actually to dissolve the tumour.
Okay.
So after 1 year, like cancer was gone.
She went back to her in Sakai City, near to Osaka in Japan. She went back to her doctors after 1 year for routine checkup, and they said, "What happened to you? The cancer is gone. There's no cancer in your body." Finished. And she lived another 4 years. 4 years more.
What did the doctor say?
And they were totally astounded, you know. Just kind of fell over with amazement. After 1 year of the Tibetan treatment, there's no trace of cancer in her body. Wow. And she was in her late 70s, and the doctors gave up on her and said she had 3 months to live, and I kept her around for another 4 years. And I think she only really passed away then because she could become a bit complacent, and she thought, "Oh no, I'm fine, you know, I feel fine, I don't need to take any more medicine." She got a bit complacent, and in her early 80s, she was about 82, 83. And old age started to catch up with her a little bit, and I think the cancer was starting to creep back a little bit as well. You know. She got a bit complacent. You know.
Why do you think the treatment was more successful for her than, say, I mean, you must see a lot of people in that position.
Well, I think karmic connection makes a lot of difference. Karmic connection, because
That's your view too, right? Cancer with karma. I thought you had last year. I remember. Yeah, we had the conversation.
So
You believe more karma with cancer, right?
I think so. Or otherwise,
In one part.
how do you explain? Two people smoke all their life, one gets cancer, one is, I mean, sure, it's
karmic connection with the doctor, though. Even with the medicines and with the doctor.
Yeah. I noticed that even in Western medicine.
So what else? What you said? Severe disease. Your experience curing with Tibetan medicine.
Each one.
Yeah. Any other severe disease?
Like hepatitis.
Hepatitis C or B?
A, B, or C. They all respond well to Rinchen Yunyin, to Dashel Jitsima. If they have headache and nausea, then to Diwan Gupa and Tita Gyepa, and Jutsi Sumjo, Dubun Nipa, Jutsi Sumjo, Tita Gyepa, all of these.
He's saying he has good result treating hepatitis A, B, C. I think there's one interesting research in somewhere in Europe. So the stomach ulcer with Helicobacter, and they said when you take Tibetan medicine, all symptoms are gone, but bacteria are there. But then they give the Western medicine, bacteria are gone, but symptoms are there. I thought sometimes it's good to combine the treatment. So your experience is you mean Helicobacter?
Yes.
Okay. Buddha is the
Hostus root.
Hostus root. Do you know hostus? The plant? It grows here too, right?
Yeah,
It's a common plant.
yeah, it does grow here.
Chonga, actually in Tibetan medicine, very much used in aconite, aconite. So that's a kind of really like a secret remedy, right? Aconite.
Something has to be secret because you can't tell the patient they're taking aconite.
Yeah,
Otherwise they get frightened.
I think that's same in Western medicine. Like patients are taking some antibiotics, they're feeling kind of good, and then they read the contraindications. They say, oh no, suddenly it will worse.
Oh yeah, nice one. Thank you.
Are they giving it Tibetan medicine? Something like, say, aconite.
It's 4, not 2. It's 4.
No, it's two. No.
Don't need to. Never need to.
And then on the bottom one, so
See, all of these.
according to Tibetan medicine.
Yeah, absolutely. Yeah. I've been practicing it for 36 years. So yeah, I mean, let's say, do thorough diagnosis, during analysis of the symptoms and any recent medical history, behavioural factors, and then I tend to monitor the patients very closely, ideally every couple of weeks, give them a checkup, update, modify, fine-tune their prescription.